Hi everybody, my name is Dr. Hilary Booth. I'm a naturopathic doctor. I just graduated and this is my first ever video blog. Today I'm going to be speaking about food intolerances. It's something that's been in the media a lot lately, with the difference between food allergies and food intolerances being sort of a hot button topic. So first I wanted to explain exactly what I see as a clinician that would warrant me doing a food intolerance test. So oftentimes patients will come in and they will say they have headaches, bloating, gas, constipation, diarrhea, digestive upset. They might have skin issues such as acne, eczema, psoriasis. They might be experiencing nondescript joint pain or muscle pain, or fatigue, especially around 2 or 3 in the afternoon, or difficulty sleeping even. So as you can see, there's a lot of symptoms here that are sort of what seem to be random. I'll explain to you exactly what's going on in the body. So what's happening when you have a true allergy, such as an anaphylactic reaction that we see with peanuts, for example, is that your body is mounting a response called an IgE immune response, and that causes the anaphylactic shock that we see. That's a medical emergency. The difference is with a food intolerance is it's a different kind of immune-mediated response. So our gut lining is supposed to look like this. It's supposed to have good integrity and be tight and absorb what it's supposed to absorb and keep out the rest that it's supposed to keep out. What happens over time if we are giving the gut a whole bunch of insult of things that it doesn't respond well to, your gut lining will start to look like this, and it will kind of be open, and there'll be gaps between it. So after a while, your food particles, and think of this on a microscopic level, will be going through the gut lining, and your body's going to see those particles as foreign. And what your body does when it sees something foreign is it attacks it. So your body is going to mount an immune response to those foreign little food particles that have gone through the gut lining, and it's going to attack it. And then it's going to form these immune complexes. This type of immune response is an IgG response, which is very different from the anaphylaxis that we talked about before. So these immune complexes will build up over time, and they can start wreaking havoc around the body. So that's where we start to see such random symptoms. For example, things in the GI tract, things on the skin, migraines, or pain. So what I do in practice when I see nondescript symptoms like that without any other sort of explanation is we can do an IgG test. So it's just a finger prick little blood test that we do right in the office, and it comes back with a result of 96 different foods that you could have an intolerance to that could be causing these immune responses in your body. So what we do then as naturopathic doctors is we help you to pull out those foods from your diet, and then we give you alternatives and different ways that you can still go about your daily life and be able to eat the way that you like to eat. It just sometimes takes a little bit of help. The other thing that we do is we prescribe different supplements to help build that gut lining back to where it should be. So again, remember, it's supposed to look like this and it started to look like this. So what we need to really do is bring that gut lining back together and help to rebuild the natural bacterial flora that should be living there. So after a while, you should start to see a remission of your symptoms, as well as just sort of overall better energy and better feeling. You might notice some other things improve as well, which is always really great to see in my practice. And then over time, sometimes we can reintroduce those foods back into the diet that you originally had to take out because they were causing the immune responses. So I hope that helps explain a little bit of the difference of these food intolerances that are becoming so popular right now, especially with gluten intolerance being kind of a forefronter in the media here. If you have any questions at all, please feel free to visit my website at hillarybooth.com. That's HILARYBOOTH.com, and there's a contact page there, and you can send me a message from there. Or, of course, feel free to book an appointment with me, and I'd be happy to do a food intolerance test with you if that's what you'd like to do, or just discuss your different options. Thanks very much for watching, everybody. Take care.